This morning, former Vice-President Dick Cheney is recovering from heart transplant surgery he had over the weekend. The 71-year-old former vice president waited 20 months for that transplant, while an implanted heart pump kept him alive.
There are some critics who are asking if Cheney should get a new heart at this age or if he got preferential treatment of some kind. With us now is Dr. Moriguchi of the Cedars-Sinai Heart Institute in Los Angeles. Doctor, good morning.
Good morning.
First question, the important question is, with respect to this kind of transplant, what does it add to the life expectancy of the former vice president?
Well, there's a good chance this will add many years of good quality life to Vice President Cheney's life. As far as the number, it's hard to say. Maybe 10, 15 years, 20 years, who knows?
Would he be considered a good candidate, doctor, considering that he is over the age of 70 and given his previous heart history?
Most of his problems were related to his heart. He had bypass surgery, angioplasties, and so forth. And obviously, when you do a heart transplant, that gets taken out. So we're more concerned at his age about the other comorbidities, including heart, lung, kidney, and they seem to be okay. So I think he's going to be a good candidate, even at 71.
How are people selected for a heart transplant? What's the list, and who controls the list, and and how long do most people have to wait, and how many people don't have enough time?
Oh, yes. Well, obviously the main problem is that we don't have enough hearts to go around, so it's very important for each of the transplant centers to select their patients correctly. And we all follow pretty much the same guidelines as far as they should not have any other problems other than their heart. We do not want any other life-threatening illnesses that would not be corrected by heart transplant. And basically, these patients are selected, and we get the best because of the limited resource. We have to give it to the best candidates.
And I keep hearing that the list is so heavily policed. There are sort of grumblings and rumblings. Did the vice president get preferential treatment? Is that even possible to do?
Pretty much not. All transplant programs, again, are under very, very strict guidelines to choose the correct patients, and you cannot buy your way on the list. Basically, even though he's such a high-profile individual, if he waited 20 months, then I would suspect that he basically did not get any special preferential treatment, which is the way we like it.
These questions always come up with respect to transplant, whether it was Steve Jobs with his lung transplant or whether it's in this case. The idea of transplants as a cure to immediate mortality, is it getting better?
The average transplant recipient can anticipate either approximately a 13-year lifespan. That's half the people be dead in 13 years. But basically, we have people out 25, 26, 30 years out, and they're doing just great. So it really is what kind of match they get, how well they take care of their heart and take their medicines, and the other comorbidities as we talked about.
What could be done to make more hearts available?
Well, that's the key point in transplantation. Organ donation is obviously the restricting factor. And over the past 10, 15 years, we've been limited to about 2,100 to 2,300 hearts in the United States. And there's literally 50 to 100,000 people who could benefit from this form of therapy. So spreading the word should help. We haven't seen a huge increase. And that's why we're going to these devices now, these pumps like Mr. Cheney had, that can serve as an alternative to transplantation. They're very, very good now. They can last 10, 15 years, hopefully, and provide an equally good quality of life.
All right, Dr. Moriguchi, this is certainly good news for the Cheney family. We thank you for joining us. I understand that you were his go-to doctor on occasions.
Right. If he came to Los Angeles, I would be there.
That you were
so
the guy.
I'm glad he did well.
All right.
Thank you so much.
Thank you, sir.